Hello, this is Dr. Gorana. Welcome to the fourth episode here on our podcast. Today, I will cover a very important topic that many of you wanted to hear about, and I'm glad that I have a perfect guest who I can talk this about. Today's topic is Propecia, finasteride, or the pill to help you grow hair. There is a lot of controversy about this medication, and there is a lot of conflicting information out there. When I Googled finasteride, I was blown away by some questions that come out on Google following the Google search, such as, does Propecia regrow hair? Is Propecia worth the risk? Is finasteride hard on kidneys? Can you drink alcohol? Why finasteride is bad? Does finasteride ruin your life? Can you take it for life? Does Propecia lower testosterone? Can I take Viagra with finasteride? And so on and so on. There is no drug that has no side effects, but much feared side effects of finasteride have been greatly overblown in a lot of chat rooms, forums, social media, etc. And I would like to provide a medical view of the two of us on this medication, the benefits and the risks of it. Interesting information, interesting fact is that in 2018, it was the 87th most commonly prescribed medication in the United States, with more than 8.9 million prescriptions. It is a magnet for personal injury lawyers. And the name, interestingly, what I found stems from the word Felicia, which is Spanish for happiness. So Propecia, Felicia, we will see whether that is the reality. It is my great pleasure to welcome today Dr. Edwin Epstein. We share the same last name, who is a hair transplantation surgeon, but also a urologist. So someone who will be able to answer a lot of questions that this medication arises. Hello, Ed.
Thank you.
Thank
you, Gorana.
Welcome to our podcast. How are you?
Great. It's great to be here.
Thank you for joining us, because this topic is burning. So I'm glad you were able to take some time to help us get some answers for the doctors and for the patients.
Well, I agree with you. There is a lot of information and misinformation concerning finasteride, its efficacy and its side effects. And it's sad, but it's been a drug that's helped millions of men predominantly for the last 25 plus years.
Can you, I just want to mention that people should know that your background is urology. So how did you end up in hair restoration field? What was the,
it's been an interesting journey to change careers at some point in my life, but I practiced urology in Baltimore for 13 years. And during that practice, I was at a faculty appointment at the University of Maryland. We had residents from the University of Maryland rotating through our hospital. And one of my partners, interestingly enough, was one of the first residents trained by Dr. Patrick Walsh at Hopkins, who finished the program. And Dr. Walsh is really one of probably two of the world's leading experts in prostate cancer and surgery for prostate cancer, and was very instrumental early on in his career with the 5-alpha reductase inhibitors and dihydrotestosterone. And one of the guys who trained me at Washington University, Barnes Hospital in St. Louis, was his second chief resident, who is also a well-known prostate cancer specialist. So I do come from a background of with that in terms of prostate cancer, and I also had a subspecialty with erectile dysfunction issues. So both of these have sort of come together
In one pill, hair
in one pill. Yes.
and erectile dysfunction. So that pill actually links your profession in some way.
It is the missing link. And I got interested in hair loss by accident. We were living in Baltimore. My family, I grew up in Virginia Beach area, and we would come down for the summers, and my 2-year-old broke her foot. And a classmate of mine who was an orthopedic surgeon, I tried to reach him for some help with the fractured foot. And turns out he was doing hair transplant surgery. And that was in 1989. And it took me a number of years to find someone who would train me. And I thought it was very interesting. It was interesting to make people feel good about themselves, as you know, and to really change lives and still have the surgical aspect that always attracted me.
Yeah.
And, it's been now almost 30 years that I've been dealing with hair loss issues.
Would you say that hair field is still interesting?
Absolutely.
I think more than ever.
Yeah. I mean, it's what's really interesting for me is to see how it's changed and to have been on the ground level with the evolution of that change. Yeah. So that's been really a fascinating, and our colleagues that do hair restoration surgery are just family now, yes, as you know, and it's just an interesting group.
Yes, absolutely. So let's start digging into this, because we have a lot of questions that should be answered today. So briefly, what is finasteride?
So testosterone gets converted into dihydrotestosterone, and the enzyme that does this is 5-alpha reductase. Now, in adult men, DHT, dihydrotestosterone, does two things. It causes a man's prostate gland to enlarge benignly, usually in their 50s and 60s. And if you're genetically predisposed, it begins the process of genetic hair loss. And what finasteride, which was originally the brand name Propecia, does is it blocks that conversion. It blocks about 70% of it. So it does lower the DHT level by about 70%.
Which is significant.
It's significant in a lot of ways. So interestingly, with the history, I mean, it was known that DHT caused hair loss and prostate gland enlargement, but it was much easier to get this drug approved for prostate, as hair loss has always been considered a cosmetic sort of problem, even though it's not. And so it was approved for the 5 milligram dose. And at that dose, it won't make your hair grow better. A lot of people come in and go, more is probably better. But studies have really shown that there was no increased efficacy of 5 milligram over 1 milligram for hair loss. But both of them shrunk the prostate to a similar degree. But the 5 milligram dose gave better improvement of urinary problems in older men with enlarged prostate.
Does it have an impact on prostate cancer, the medication itself?
So, that's a really good question.
That patients ask, what's going to happen?
Yeah.
Because I have a family history. Can I take the medication or not?
Yeah. So the short answer, I think, is that we really are not sure. But I think that the longer answer, if I can give you that, is that the controversy developed in the earliest study the thought is that using finasteride would lower the incidence of prostate cancer. And the large study that was done back in the early 90s in nearly 20,000 men was that it reduced the incidence of low-grade prostate cancer by somewhere around 20 to 25%. But they also found that it increased the incidence of high-grade cancer. Okay. And over time, I think where that has evolved in terms of why is that it didn't really increase prostate cancer high grade. What it did was it shrunk the prostate so that it was now an easier biopsy target to make the diagnosis. And the second thing that was done is they followed those men over a 15 to 20 year period, and there was no increase in cancer death in the group who had high-grade prostate cancer and took finasteride versus the group that had took finasteride. And I think that that's where it is now. It's not really been shown in longevity studies that there's increased risk at developing prostate cancer. Now, the one question you did ask is, what about people with a family history of prostate cancer? Because there can be a very strong predisposition with genetics in that. And so, men who are over 40 who have a strong family history of prostate cancer should get routine PSAs.
Regardless.
I think regardless, yes. And when I say strong, it would be a father and maybe that father's the grandfather or some, uncles. But routine screening for prostate cancer with PSA has, in the last few years, become out of vogue. And I think now we're seeing more cases of metastatic disease popping up because of that. So I think the pendulum will shift back to getting routine PSA screening for prostate cancer.
Yeah, because we'll get back to that story, the topic of prostate cancer when we talk about side effects. But that was just a link because you said
yes.
that originally it was used for BPH. How does it work for hair? What's the mechanism of action? Does it grow new hair? That's the common question. Does it thicken existing hair? Does it work better in the front, in the crown? What is your finding?
So I'm going to describe this as if you were my patient, because
that you care for, that you very care for.
Yeah. So what DHT does to the hair cycle is that it begins the process of miniaturization. So with each hair cycle, the hairs get thinner in diameter, shorter in length. There's less pigmentation. If you have curly hair, it becomes straight. And with each hair cycle, that change occurs until baldness develops. And it really depends on how strong the gene is. Interestingly, and I'm sure you've seen this as well, often you see men at 17 who are already bald. And then you have a group that's 35 or 40 that have had no hair loss, and all of a sudden it kicks in again. So I don't really understand why that happens, but I see it frequently. But by lowering DHT level, I found that two things happen. One is that for the majority of men, it slows down the process. And I think for 80 to 90% of men, and this is what the early studies showed, is that it can significantly stop hair loss. It's not to say it won't continue to some degree, but I have hundreds of men who have more hair now than when I first saw them 20 or 25 years ago. And then about 50% will see new thickening of those weak hairs, which in their mind is new hair growth.
Right.
And I'm sure you've seen this as well, but I've seen dramatic changes. I mean, it's life-changing for some men. And a lot of men who don't take pictures to monitor their progress will quit using it because they go, oh, this isn't working.
Exactly, because they forgot how they used to look like when they started with the medication.
Exactly.
Do you have like a longer follow-up? Or in other words, do receptors get jaded after a while? So how long could medication be used? Is there any limitation to the time that the finasteride can be taken, or you think it's safe to use throughout the life? Because hair loss is progressive.
Yes.
So there is always have to be something slowing down or stopping the hair loss. So that's my question. How long can it be used?
Well, on a personal note, I've used finasteride for over 25 years. So I was going through a time in my life where I wasn't so savvy about the stress-related hair loss. And so I was losing hair in my crown, and I started taking finasteride in my 40s. And it's maintained my crown. My father had the same head of hair that I do. But I remember in his late 60s and early 70s, he was starting to lose his crown. So I've maintained mine. Now, the other question I think you're alluding to is, do the receptors develop some sort of resistance over time?
Over time.
And yeah, I think they might. And so, sometimes the patient comes in and goes, my hair's, I feel like it's getting thinner. And so I may bump the dose up or consider using dutasteride, which lowers DHT by 90% and probably works a little bit better than finasteride. I just don't use it as a first-line drug.
Right. Do you have any view whether finasteride is better for the hair loss in the front or for the crown? Is there any difference from your experience?
Yes, I think just about all medical therapy works best from back to front. On occasion, some of that temporal thinning that some people get sometimes comes back, but generally I find it works not so effective in the frontal areas.
Right. You mentioned that if I was your patient, this is what you would tell me. Women cannot, childbearing women cannot use the medication. That's the...
So, yeah, and this is a real misconception. There's a disclaimer that it can have a birth defect.
Right.
Right. And so that birth defect is, I think, still theoretical. They, in the early animal studies, that they gave some crazy volume of intravenous finasteride, and basically the monkeys got hypospadias, which is a condition where the urethra doesn't come all the way out to the tip of the penis. But I've yet to see a reported case. First of all, that change occurs if it's going to happen in the first trimester. But I've yet to see a reported case of hypospadias where it was directly related to finasteride. But I still would not recommend finasteride in women of childbearing age, only in postmenopausal women. Sometimes women who have PCOS, polycystic ovarian syndrome, I'd probably work through their endocrinologist or gynecologist to see what they think would be most effective. And I'll stop there.
Okay.
There's another indication that you might ask me about, but and that's the frontal fibrosing alopecia.
I was about to say, what about that? Because I love it for frontal. For an FFA, I love to use both topical and oral therapy. Of course, if it's postmenopausal women. There was a recent question in our chat, American Board of Hair Restoration Group chat. Is there any transcutaneous absorption? Like, can pregnant women be, I don't know if you read it, can they crush or break the med for their partner if they're pregnant? So, and there is then someone listed a study that obviously is highly unlikely that enough of medication is going to be resorbed through the skin. But just what is your view on that? Like, can women be handling the med for their husband or partner, or get far away from it?
Well, I was thinking about, ironically, I was thinking a little bit about that because of the increased use of topical finasteride and some other things. But if you think about, for example, minoxidil is probably used much more prevalently as a topical.
Yes.
And one of the concerns when Merck was trying to develop the oral version of finasteride and they moved away from a topical version was that very concern that there might be some absorption on the bed pillow or things like that. But I've never heard of anyone saying, oh, I've got a lot of facial hair from my husband using minoxidil. And if there was a concern about absorption through the skin by handling the medication, I would never have anyone split the 5 milligrams. I would only prescribe the 1 milligram. That just takes that variable out of there.
Are you comfortable when you prescribe 5 milligram in terms of consistency patients are getting when they're crushing it?
Yeah, I don't think it makes a difference because the effect on the 5-alpha reductant on the receptor, it lasts so long. I'm not sure it makes a difference. Now, that being said, I have an anecdotal note. I have a friend who ran a generic pharmaceutical company, and he showed me how these drugs are made and how it's mixed up. And there's no way that you could, split it up and one portion would get the full 5 milligrams and the other would. It just doesn't happen that way.
I was actually, when I was sort of getting ready for this episode, there was one interesting article that one of our hair friends actually had a patient who switched from brand to generic, and the patient experienced excessive shedding. Mm-hmm. And then I researched, because this is a funny story. Recently, I do a lot of YouTube video for my practice in Serbia, and patients, they recommend what to talk about. And someone said, can you make a video about homemade hair loss medications? And I was like, what is that? And then I went online. There is a home industry of people mixing meds at home. Okay. And there is a lot of, as we know, online pharmacies that sell finasteride and other medications, not just for hair loss, but for other medications. But then I found that World Health Organization estimates that medications purchased from online pharmacies are 50% counterfeit.
Mm-hmm. It's huge. It's unbelievable.
It's really, that data was unbelievable for me. So patient must know what they're getting and stick to the medication that is right, the right doses, the right brand, instead of doing their own stuff, because that can also have impact on the result for sure.
Well, this issue came up a few years ago, and I consulted with my friend that I just mentioned. And if you had a let's just say a blood pressure medication that had a really fine zone in which therapeutic zone, it might make a difference brand versus generic, but not so much with finasteride. But I do think what happened, because I looked this up too, is that there were a number of countries making generics that don't use the same FDA controls that are done here in the US. And so people may have been getting either counterfeit or poorly made, poorly controlled generic drugs that may not have been as effective.
Yes. So just for all of you listening, consider how you're getting your medication to begin with. So let's talk about the hard stuff, and this is what the controversy about this medication is, and these are side effects that internet is burning about. I'm going to list a few, and of course, the most concerning one for many of finasteride users are sexual side effects, including sexual dysfunction, impotence, ejaculation disorder, decreased volume of ejaculate, reduced sperm count, reduced sex drive. On top of that, it has been talked a lot about depression and suicidal ideation in the past couple of years. And there are other side effects that are, let's say, minor, but also important, such as hypotension, dizziness, headache, weakness, and so forth. There was a study I'd like to mention, done in 2017 about persistent erectile dysfunction that concluded that it only develops in 1.4% of finasteride users. So it's low, according to this study, but the talk is huge and loud. So what do you think about this?
Well, the first thing is what I tell patients is that in men under 40, the incidence of side effects is less than 2%. Now, if you go online, you think it's 200% because it gets blown out of proportion. That being said, I do think there is a subgroup of men that we don't quite understand who they are or why, who are developing symptoms. And it's a symptom complex. And it's a very similar complex as men using the antidepressants, the SSRI inhibitors. The very similar symptom complex.
Yes.
But so if I was a urologist and my practice was sexual medicine problems, I'd probably see a high percentage of people coming in with sexual side effects. But I think when you poll dermatologists and hair transplant surgeons that are medically treating using finasteride, it's a really low incidence of side effects. Now, is that because the people who have problems don't come back and tell you? Or is the urologists and the sexual medicine people just seeing that small group? I don't know the answer to that.
Is that your personal experience in your clinical practice, that you don't see many of these patients, or they rarely come, or they don't come? What's your experience?
I can probably count on one hand the number of people who have had a sexual side effect that persisted, and maybe two in my practice over all these years. There are side effects that but if you break up the side effects, it has an effect on the prostate. It shrinks the prostate. So it's going to affect ejaculate volume. It may affect the quality of the orgasm. Gynecomastia is definitely, it happens, although, like I said, I think it's still under that 2%. And it's often preceded by some breast discomfort. So I think some of those are real side effects. Once you start getting into depression, reduced sex drive, reduced sensitivity in the sensory in the penis, there's a whole group of side effects that people describe. I think there's a subgroup of people who get them, but it's extremely rare. And I don't know if the drug is causing it. And if it is, I don't think anybody understands who it's happening to or why. But there are a group within the sexual medicine world who their life mission is to prove that finasteride is causing all these things. And some of them are very prolific writers, and some of their studies are funded by the Post-Finasteride Syndrome Foundation, who is very vocal on the internet.
Yes, I've seen that, and I went through a few studies, but it is a complex issue, because when we talk about depression in patients who are taking finasteride, there is a biological thing that happens. Finasteride does lower isopregnonolone, which actually does contribute to depression. However, many of our patients are overly concerned about hair loss to begin with. Not to say they're all depressed, but there is some sort of concern and sadness over hair loss. So it's the question, what's older, the chicken or the egg? What was depression already there when they started the med, and now the med is to blame for depression or for not achieving results with the medication for hair to regrow hair as they wanted. So that's one aspect, like how much is mind over the med.
Yeah.
With this medication. And then there is also the nocebo effect, right, that we know. If you have a patient who wants to regrow hair, and we know how our patients are so passionate to have their hair back because it's bothering them, and they read the list of symptoms, and it gets inevitably in patients' minds. I don't blame them. You list them, and now with the word persistent that is introduced into side effects, persistent sexual side effects, it is concerning, and many of them cannot take that out of their minds when they start taking medication. So I think there is a lot of psychological in the entire process with the medication.
And I could not agree more. And in some ways, it's sad to me because it's a drug that has helped so many men and really preserved their hair loss until, sometime in the near future, there hopefully will be some sort of stem cell or some other therapeutic modality that, as long as you still have your hair follicle, you may be able to improve with it. And early on, when Merck started marketing finasteride, Propecia, advertising, they took a different approach than the people who made Viagra. If you remember the early Viagra commercials, the couples holding hands, walking out into the sunset, they didn't really say what the drug was or what it did. You just implied it. And unfortunately, in those days, and perhaps still now, with Propecia, as long as you mention the brand name, you have to go down the whole list of side effects. And of course, erectile dysfunction was one of those. And that's really frightened a lot of people. And then when the internet became so prevalent in our lives, the whole world would find out people's stories. So now people were getting a lot of information and misinformation, as they are now. Yeah. And I think for us who are treating hair, I think we have to be sensitive to people's concerns about it, even though I think in most of our experience, it's infrequent. But if you're that 1 in 100 or 1 in 10,000, it's a terrible problem. So I think we have to explain to people what the options are, let them be educated consumers as they already are, and try to redirect them with the information. But I think we have to give them therapeutic options based on their concerns.
Yeah, I agree.
Yeah.
I always say the best patient is educated patient, but not overly educated patient.
Exactly. Well, you know what? It's really interesting to me. There are at least 3 or 4 online companies where you can get your finasteride, and you don't talk to a physician. And I come in, so many people come to my office and go, oh, well, I've been getting it from such and such a place. And they're not told about side effects. Or if they're told, it doesn't really register because thousands of men are using these online sites without real medical discussion, I don't think.
Those who want quick fix.
Yeah.
Without being evaluated by a doctor, but without hearing the explanation what the risk is. What is interesting is that for the first 15 years of Propecia, no one was talking about side effects. And then suddenly, 2012, it just started. But also interestingly, 1 milligram does give this side effect, but not 5 milligrams. And it happens in patients who are losing hair. And that's why I come back to that psychological background of who is using it, what's the mindset of patients who are using it, without denying there is physiological component that might happen, but whether in this degree, we don't know.
Yeah, so that's a really interesting point. And, most of the younger guys, when I say younger, the age group that's under 50 who doesn't have prostate gland enlargement, who would be either splitting up a 5, or maybe they're using a 2.5, or maybe the whole 5 milligram. You're right. They don't really describe that. And then you have men who use the dutasteride, which lowers more DHT, and you're not seeing that permanent side effect, that persistent side effect. So I think there's just a lot we don't understand about both the psyche of who is most susceptible, not really psyche, but why some people are most susceptible physiologically, and really the drugs themselves.
But also, around 40% of men 40 and older have sexual dysfunction for a myriad of different reasons, which is not the med. It could be stress, could be job, could be some other medical issue, could be relationship issue. But let's get back to the med. Let's blame the med. That med is causing it all. Yeah. It's not just that black and white. That's my opinion.
I think it's prevalent in the younger groups too, the 25 and 25 to 40-year-olds.
Because they're greater internet users.
Yes. And there are a lot of websites where they may be watching, where they may not be able to perform quite as well as those studs in the website. So there might be some performance anxiety that develops.
Yeah.
If you're reading between my lines here.
I think I am.
Okay. I don't know who our audience is, so I'm trying to be discreet.
We will find that out after airing the episode.
Yeah.
What do you think of topical finasteride? Do you like it? Do you prescribe it?
Yeah. So I have. I've been prescribing it for.
Many of my patients are like, Doc, I don't want to take the pill. I don't want any systematic. So give me a topical. And I always tell them, topical is not just topical. It's always systematic. Just keep that in mind.
Well, there's not a lot of studies on this, maybe a handful. The ones that I've seen have not demonstrated really systemic absorption to any degree that's affecting the parameters that we usually measure. So I think that's the good news. And I do think from seeing results from a number of our colleagues, but of course they're showing you their best results, that it works. And I've seen mixtures using minoxidil with latanoprost.
That's the group who mixes it at home.
Yeah, dutasteride. I mean, there's so much. But the biggest problem with topical is compliance, I think.
It is.
It's compliance. And so, but I do think it's a great option for someone who's concerned about taking the oral. And I'll say one other thing about what I do with some of those men who are a little concerned. I like to have them tiptoe into the water a little bit. So we know that 0.2 milligrams is the least effective dose of finasteride that will grow hair. So I tell people, take the 1 milligram, split it in half, and start off with a 0.5 milligram.
Yep.
And let's just see what that does in terms of hair growth and side effects.
Yeah. I think also what is important for patients to know is the quality of the lotion they're getting, because there is a lot of compounding happening right now. People want to put everything on their hair. It's not necessarily that more is better. So to use minoxidil, finasteride, dutasteride all together doesn't necessarily mean the result is going to be better. Now we have genetic testing as of recently that tell us that a lot of patients are not responding to minoxidil at all, or finasteride, they should opt for dutasteride and so forth. So that's one thing to keep in mind. And second thing is to have a consistent lotion, because there's a lot of pharmacists out there. You have to have a good pharmacist that knows the vehicle for the meds and to know how to mix them, because some of the meds do not mix together. They don't dissolve in each other. And patients are like, give me that, give me more. What else can I use? And just that would be my take home. Just like, not necessarily that you put, it's like with the water, with the plant. Any plant needs a different amount of water and sun. Some plants do not need to be watered every day. Some do. So it's just a matter of how much.
That's a great point.
Needs water. Ed, to conclude this, if your son or nephew or someone comes to you, say, hey, doc, or hey, dad, or hey, uncle, do you think I should go on this med? I've been reading a lot. I've been listening a lot about this. There is forums, there is chat, there is experience, there is post finasteride foundation. What should I do?
Good question. And I always treat patients as if they're family. So I use it. I have 2 great nephews that are in their 20s on it. I have a number of family members that are and friends that are using it. So I caution them like I do with everyone. Please stop it if you notice anything weird, strange, different, or unusual. But I feel that finasteride is such a game changer in people's lives that it should be part of our therapy for hair loss.
Yeah. Another thing I wanted to ask you, there is a group of doctors who would tell patients, take this med, it's going to for sure grow your hair. Any med, not just talking. I'm not saying just about finasteride, but this for sure it's going to work 100%. You're going to regrow hair, and they're just overpromise. I'm not like that. I'm like, this is what clinical studies show. This is my experience so far. Let's see how you do for 3-6 months, and we'll take it from there. We can always adjust. Do you list up front the side effects of the meds, or you do not mention them?
No, so my routine is I talk about the side effects that are most commonly reported, which are going to be breast tenderness, gynecomastia, sexual side effects, erectile dysfunction, yada, yada. And I say that there are a small group who feel that those side effects persisted after they stopped it. I don't do an informed consent, but I do not, because it's an approved drug, but I do record in my notes that we had the discussion of both the side effects and the persistent side effects. And of course, I tell them, read through the list. You're gonna get that with the patient information. If you have any questions, please call me. But anytime someone reports a side effect to the FDA, it's going to be on that list. So I usually go over the ones that are most commonly reported.
Right. Perfect. This was really wonderful. It was a wonderful talk. I hope we answered questions. If more of those questions come, I'll have to bring you back to the show.
Well, I appreciate the opportunity. I really appreciate the opportunity. It's something that I've worked with for a long time, and I've enjoyed. I appreciate you looking at me as a potential expert, although I'm just been using it a long time. It
wasn't based only on your last name. Believe me, why I brought you to this early episodes, actually, because I think I know how important this topic is, and I just wanted a high quality talk, and that's your name just came up first.
Well, thank you. Yeah.
Thank you for your time, and I hope I'm going to see you again here.
Well, hopefully, if questions come up, we can do this in this format or something else with callers. Who knows?
Perfect.
Okay.
Thank you.
Thank you, Gorana.
Thank you so much.